Hello, my name is David Gurevich, author of Adult ADHD, What You Need to Know. Today I'm here to talk to you and answer a kind of question that some people have from my perspective as someone who's studied the area very much. The question is, do ADHD medications like Ritalin and Adderall stop working? This is a very, very common question people have. And the research that I've looked at from the work of Dr. Biederman, Dr. Holloway, Dr. Paul Wender, and as well as a personal discussion with Dr. Tuckman, Vice President of the ADD Association. These clinicians, they all say the same thing, that in general, ADHD medications keep working, that they still work even for years. So really the question is, why is there this perception that they stop working? I think the perception that ADHD medications stop working is largely in part because certain effects do tend to stop working. I think a lot of it comes from people who might use them from an abuse perspective. If you're taking, a medication, an ADHD medication, looking for an unusual effect, such as getting high or being able to study for hours without thinking, getting tired or getting distracted to some degree. If you're looking to kind of completely suppress your normal human experience or to achieve an unusual effect, then those kinds of effects actually you do develop tolerance to, and they're not as strong. However, the general fact of treating the symptoms of ADHD, according to these researchers who have treated thousands of patients, maybe even tens of thousands of patients, they all say the same thing. So that in general it doesn't happen. It can happen, but if it does happen, usually it's reversible by taking a week or two off from the medication. In general, ADD medications like Ritalin and Adderall, Vyvanse, the stimulant class tend to keep working for years. Okay. There are a few things that might reduce there are a few things that might make it mask the efficacy of the drug. You might gain weight. Gaining weight, if you gain like a significant amount of weight, the drug might not be as effective. That's one thing. Another thing is that you might not be on the right dose. You might be on too low a dose or too high a dose. That can, you might not get the symptom relief. Another is that you might get promotion, or you might have more responsibilities. You might be taking ADD medication, but you get a promotion, or you just had a kid and suddenly it doesn't feel like it's working the same way it used to. It's not that it's not working, it's that you have more responsibilities. So you're kind of more taxed. Additionally, there are things that can cause ADHD-like symptoms. Depression, if you suddenly become kind of depressed, you might not be able to concentrate even though you're taking ADD medication. It's still working, but if you're depressed, having bad concentration span is kind of normal. Finally, you might be on long release. And longer release medications can sometimes feel like they're not working later on in the day, or maybe right after you take them, because they kind of take a while, they reach the max, and then they level off. So if you're here or here, you might not be getting the same effect. I hope that clears some things up. Thank you very much.